Hello everyone, let's do a very quick review for the 75 years old patient of mine for whom I already have shared some videos on my page. So patient walks in with severe pain on the upper jaw and almost all of his teeth in the upper jaw had pulpitis and also were with some periapical lesions around some of his teeth. So his main goal was to be pain free for the moment and to be able to bite on food. From the occlusal or top view, we can see that teeth have severely worn down and there is barely any vertical height of the tooth structure left, especially those in the front. And also we can see one root stump here. You can see one root stump and the vertical height is reduced, especially on the palatal. We can see that the tooth structure on the palatal side is almost up to the gum line. So there is barely any height left on the palatal. The primary goal of the treatment was to make the patient completely pain-free, achieve a stable and functional occlusion by raising the bite or increasing the vertical dimension of occlusion and proper alignment of the upper and lower teeth. Ideally, this was a full mouth rehab, but as I said in my previous videos, the patient was not ready for full mouth. He only wanted to get rid of the pain, be able to bite, and restore his upper teeth only. A huge credit of this case, I would say, goes to the lab as well. Without their support, their precision that they provided in each and every stage, this case would never have been possible. The bite alignment and everything at the end was incredible. Patient was given 3 choices, all on 6 after extraction of all of his upper teeth. Then option 2, teeth supported bridge for the remaining teeth in the mouth and 2 implants to replace the first molars. And option number 3, a complete removable denture. So patient went with the option of retaining his upper teeth, the remaining teeth, restoring them, and then doing 2 implants to restore the first molars. And as I said, the primary goal was to make the patient pain-free. So we proceeded with the root canal treatments of the remaining teeth. We extracted 2 of his periodontally compromised left, central and lateral, and also the first molar root stump on the right. After the root canal treatments for all of his teeth, we did post and core buildups, and with that post and core buildups, we raised the bite up to some extent. The bite of this patient, since it was collapsed completely, was gradually increased as I didn't want to put a lot of stress on his TMJ, and eventually he would end up having TMD. So I raised the bite gradually. Initially, we raised it with some post and core buildup. After that, we gave him a temporary bridge made with PMMA, and we left that bridge in place for about 2 or 3 months. There were 2 purposes of the PMMA temporary bridge. Initial purpose was to raise the bite gradually, and the second purpose to let the tissues heal, and after that we would take another final impression for the permanent ones. Since we did crown lengthening, we did extraction, so we needed the site, the gums to shrink. And for that, if you would have gone for the permanent restoration, patient would probably end up with some spaces around the restoration and the gum line, So that's why it was very important to give him the temporary until the gums were fully healed. And then we called him again for a second impression for the permanent ones. And here you can see the final results. A very nice restoration, which was very well aligned with the lower jaw. Although we didn't do the lower jaw, the gums were nicely healed. Patient was happy and I was happy as well.